Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, January 8th. It is 5:03 p.m. So we started talking on Monday about things we do to our skin, which may not be too good for us. So we talked about tattoos and we talked about permanent makeup. So today, let's discuss another skin altering topic. Body piercings. Hello, Kim. Okay, so most of us are pretty comfortable with girls and even guys these days having their ears pierced, right? Okay, normal, right? Maybe even 2 on each ear. Lately, I find the piercings are getting to be a bit much. Call me old-fashioned, but I see nose, I see eyebrows, I see lips, I see, all the way down the ears. Not my cup of tea, but, then there's the good old tongue, the belly button, and we're not going any further than that, but you know what I'm talking about. Okay, so regardless of the type of piercing you get, they all come with some of the same risks. Okay. Number one, first and foremost, with anything that you do to penetrate the skin and alter the skin, number one is infection. So as with any open wound, a piercing can potentially get infected. Some piercings need to be left in for months, meaning the jewelry needs to be left in for months so they don't close up. Okay, things like the ear, usually it's about a month's time, if I remember correctly, when my daughter had hers done. But other areas that are more cartilaginous, like the top of the ear, they require longer amounts of time. Otherwise, you take the piercing out, you're never going to get anything back in there. Okay. During that time, sweat, dirt, and bacteria can get into that area and lead to infection, which can require antibiotics, removal of the piercing, and even scarring of the area. Now, you think about this and you say, that's not likely, but it is, okay? And I've seen even kids who don't really take good care of their piercings have problems. Number 2 problem you can have with a piercing is scarring. You can develop that even without an infection. Skin heals in varying thicknesses depending on the area, but also the skill of the technician that does the piercing. And I'm not just talking about the ears. I'm talking about all different areas, okay? Number 3 is migration. This is specific for the belly button. The barbell that actually keeps the piercing outside, so it's outside of the belly button, can move as the skin moves. That's an area of your body that is kind of moves around as you move around, exercise, and do whatever. And it actually can break through the skin, making it more prone to infection and obviously losing the piercing effect altogether. The whole thing could just come right through. That's going to be based on the technician, how well they're equipped and skilled at doing them. Number 4 is called rejection. Piercings are foreign bodies, so in some people, especially if not properly cared for, it can actually be forced out of your skin. It can be forced away from the skin surface, and your body will reject it. Number 5, disease. Okay, the risk of hepatitis and other blood-borne pathogens can occur if the place you're going doesn't have properly sterilized equipment. Straight out, plain and simple, okay? And number 6 is injury. Piercings can catch on clothing or other things and actually tear through the skin around it, causing damage to like an earlobe or whatever area it might be, bleeding, and et cetera, et cetera. Some areas are more prone to problems than others. They recommend wearing smaller studs, okay, not hoops or anything like that in the beginning, and taking them out when appropriate, obviously, will help. You don't want to be wearing hoops if you're going to be doing some type of activity where you're prone to, somebody grabbing your hair or reaching for your hair. I remember my daughter getting her finger caught in my earring when she was a baby. I stopped wearing hoops for a long time because it didn't pull through, but it hurt like heck, so that wasn't going to happen again. Okay, so let's talk about concerns for specific areas. Nose piercings, whether it be here or here on the side, especially the ones through the center, though. The septum cartilage that divides this side from this side, the piercing can actually result in what's called a septal hematoma, and in some areas can actually lead to more complications. There's a lot of blood vessels in the nose, so if not properly done, you can clearly have a lot of bleeding. So that's something that you have to be very careful about. In the ears, flesh holes, they're created on purpose by actually stretching the piercing. I've seen them where people, they put rings in them to make them so that they're these big holes. I find it extremely unattractive. But there's a point of no return where the hole will never shrink back again because you've just stretched the skin too far. For each person, it's different. So for you, it could be 5 millimeters. For the next guy, it could be 8. For the other person, it could be 3. Don't do something that you can't reverse. Just saying. Okay, and then the tongue. First of all, the tongue is extremely vascular, so the risk of bleeding is huge. But the risk of choking, if the piercing gets dislodged, is very real. And then there's huge reports. Listen to 15 to 40% of people with with tongue piercings complain of damage to their teeth due to the metal hitting onto their teeth. I just find that unacceptable. I mean, why would you take that risk and damage your teeth? And in the first few weeks, especially, difficulty speaking because you're not used to having something in your tongue. Not only is it a foreign body, but your tongue is going to swell on top of that. Okay, just not appealing to me. And lastly, the eyebrow. Okay, here and here. Danger to the nerve over the brow right here. The supraorbital nerve can result in loss of sensation to part of your nose, your eye, and part of your face. I mean, it's all in this area. I mean, I'm not in for that, right? That's just, I didn't sign up for that. So generally, though, piercings are safe. I don't mean to be doom and gloom, but if done by qualified licensed professionals and if they are treated and cleaned properly. Okay, but knowing the potential risk, especially to areas that I didn't mention. Okay, I've seen a lot of piercings in areas that you'd be like, doesn't that hurt? That it really needs a lot of care and a lot of cleaning. So to me, the question to ask is the benefit truly worth the risks? I don't know. I'm an ear piercing kind of gal. That's about it. So I don't know if you guys know anybody with piercings in other areas. They're welcome to comment. Please keep it clean because this is still a public site. I don't need to hear anything graphic or whatever. But again, that's just my opinion when it comes to piercings. So on that note, I hope you guys are having an awesome day. And I will be back again tomorrow for another Live in 5.